And next Friday, a system of superior vena cava. System of superior vena cava. Brachiocephalic vein, veins of the head and neck, and veins of upper extremity till here. Veins of the trunk, they are also superior vena cava, but I ask veins of the trunk together with inferior vena cava. Vena cava superior. It forms with the help of right and left brachiocephalic veins. And one vein opens into superior vena cava, that is vena azygos vein. But I said that this is vein of the trunk, and I explain this vein together with inferior vena cava. Clear? Because it is vena lumbalis ascendens, continues into azygos on the right side and hemiazygos on the left side. Next time. Today, veins of the head, neck, and upper extremity. Brachiocephalic vein forms with the help of internal jugular and subclavian vein. This is internal jugular vein. It starts from what? From jugular foramen jugulare, from here. That is beginning of internal jugular vein. The same we have external jugular vein, vena jugularis externa, and we have anterior jugular vein, vena jugularis anterior. Anterior jugular vein usually opens into external jugular, and after that external jugular opens into subclavian. Here it is the same, internal jugular, subclavian, external jugular, and anterior jugular. And anterior jugular vein on the right and on the left side, they join together with the help of arch, arcus venosus juguli, above of jugular notch of sternum, or in lower part of the neck, they anastomosis, right and left anterior jugular vein with the help of arcus venosus juguli. Some veins opens into brachiocephalic. They are inferior thyroid vein, vena thyroidae inferior, vertebral vein, vena vertebralis, and internal thoracic vein, vena thoracica interna. And internal thoracic vein, it receives vena intercostalis what? Anterior, musculophrenic vein, superior epigastric vein, and pericardiac-phrenic vein. The same like in the corresponding arteries, yes. That is internal thoracic vein, opens into brachiocephalic. Artery starts from subclavian, yes, but vein opens into brachiocephalic vein. Now, internal jugular. Internal jugular vein has intracranial inflows. All blood from brain, from meninges of brain, goes to jugular foramen and then continues to internal jugular vein. That is intracranial inflows of internal jugular vein. And some extracranial veins, the same opens into internal jugular. Extracranial, for example, vena facialis, vena lingualis, superior thyroid vein, vena thyroidea superior. Sometimes we have middle thyroid vein, vena thyroidea media, and pharyngeal veins, vena pharyngea. All of them opens into internal jugular vein. They are extracranial inflows. Now intracranial. Look here. This is skull bones, and it is meninges of brain, that is dura mater, here, dura mater. And dura mater makes, here broken, that is this is a structure in midline. We have falx cerebri. It separates left and right hemisphere of brain here in sagittal plane. And this is tentorium cerebelli. Below of this tentorium here we have cerebellum, that is tentorium, and here falx, that is part of the falx cerebri. And now look here, I draw. This is parietal bone. Here is absent, and this is dura mater, and it makes falx cerebri, which is subdivides right and left hemisphere. That is dura mater. And dura mater fused with skull bones. There is no space between dura mater and bones of the skull. There is no space. They fuse together. That is connective tissue. And here two layers of dura mater in falx cerebri, the same fuse together. But here, between bones and dura mater, we have space. This is sinus, superior sagittal sinus. Superior sagittal sinus, it starts from frontal bone, continues to parietal bone, then goes to occipital bone, and finished here in place where some sinuses join together. That is confluence sinum. That is superior sagittal sinus. And here we have deoxygenated blood. And inferior sagittal sinus, it is between two layers of dura mater in lower part of falx cerebri here. And inferior sagittal sinus then continues into straight sinus between falx cerebri, between falx and tentorium cerebelli. Here it is sinus rectus, and sinus rectus opens also into confluence sinum. Two sinuses, only two sinuses, makes with the help of dura mater inferior sagittal and straight sinus, sinus rectus. All another sinuses between skull bones and dura mater. For example, look here. I said that here superior sagittal sinus, it comes to confluence. From confluence, transverse sinus, and transverse sinus continues into sigmoid sinus, and sigmoid sinus opens into jugular foramen. Inferior sagittal sinus goes to sinus rectus. Sinus rectus, the same, goes to transverse sinus, sigmoid sinus, and jugular foramen. The same from confluence another way, that is occipital sinus, and occipital sinus continues into sinus marginalis, marginal sinus, right and left, and both of them goes to jugular foramen. Another sinus here in lesser wing of sphenoid bone, sinus sphenoparietalis, here and here, and sphenoparietal sinus goes to cavernous sinus, sinus cavernosus, laterally from sella turcica. In front and behind of sella turcica, we have intercavernous sinus, anterior and posterior, then sinus petrosus inferior and sinus petrosus superior. And blood from sinus sphenoparietalis goes to cavernous sinus. From cavernous sinus, two ways. One way is through inferior petrosal sinus directly into jugular foramen. Another way is through sinus petrosus superior, then sigmoid sinus, and also into jugular foramen. All of these sinuses, all of them, are intracranial inflows of internal jugular vein. All of them goes to jugular foramen. It was internal jugular. Now external jugular vein. External jugular vein forms with the help of occipital vein and posterior auricular vein, vena auricularis posterior. And external jugular vein, it receives vena retromandibularis, Retromandibular vein forms with the help of vena temporalis superficialis and vena maxillaris. And after that, retromandibular vein goes to external jugular. Sometimes it also has communication with internal jugular vein. And suprascapular vein, vena suprascapularis, the same comes to external jugular vein. And I already said that anterior jugular vein usually also opens into external jugular, and after that it goes to subclavian vein. They are veins of the head and neck, and somewhat about veins of upper extremity. In upper extremity we have two types of veins, superficial and deep. Deep veins are the same like arteries, and all of them are double veins, except axillary and subclavian. Axillary and subclavian, they are single veins, but we have one brachial artery, arteria brachialis, and near of brachial artery we have two veins, two vena brachialis, one radial vein artery, and near of radial artery we have two radial veins, ulnar artery and two ulnar veins. Anterior interossal artery, two anterior interossal veins, two posterior interossal, two deep veins of the arm. Clear it is. Double veins. Deep veins are double veins except axillary. Axillary is single. They are deep. And superficial veins. Superficial veins are under the skin, and on the lateral side of the arm we have cephalic vein, and cephalic vein opens into axillary vein. On the medial side, or ulnar side, we have basilic vein, and basilic vein opens into brachial, vena brachialis. Between cephalic and basilic vein, in cubital fossa, we have vena mediana cubiti. It's joined together, cephalic and basilic. And this is most popular vein for intravenous injection, or if we need to receive venous blood. I think everybody gives venous blood. From what? From vena mediana cubiti in cubital fossa. And last is vena mediana antebrachiae, that is on anterior surface of forearm, and usually it opens into vena mediana cubiti. Four superficial veins: cephalic, basilic, vena mediana cubiti, and vena mediana antebrachiae. They are veins of upper extremity, superficial and deep. All in other veins, for example, axillary vein, it receives vena subscapularis, vena circumflexa humeri posterior, vena circumflexa humeri anterior, vena thoracica lateralis, vena thoracica superior, thoraca acromialis. They are the same like branches of corresponding artery, and cephalic vein, which opens into axillary, but the same artery is absent, only vein we have. Well, veins of the head, neck, and upper extremity. Veins of the trunk, not necessary to read. Next Friday, on Tuesday, mini exam.